Welcome back. Well, let's get talking to one particular company. Rainbow Children's Medicare is the next management that we have on the show. It reported a decent set. The margins came in healthy. Average revenue per occupied bed was up around 7 odd percent. We have Ramesh Kancharla, who's the chairman and the managing director at the hospital, joining in to discuss the performance this time. Thanks, sir, for joining in. If you could just start by telling us what took place in the occupancy this quarter. There was a dip to around 46.5%. Versus over 53% last quarter.
That's right. There is a slight dip in the occupancy because of, so we have seen unusually kind of the quiet season, especially in the pediatric outpatients and the pediatric admissions and related pediatric intensive care admissions. That was actually brought down the kind of overall occupancy and to an extent some revenue as well.
So what can you guide for the entire year when it comes to occupancy and revenue per bed? And how does that move your margins?
I think if we go back and see that Rainbow has been always a 3 years CAGR or 5 years CAGR, we've been growing at 16%. I think that now we have added a lot of beds in the last couple of years' time, and we're going to have some more beds coming in, about 250 beds this year. So I would expect a late teens to 20% of growth for the current year. The macro seems to be fine. The monsoon is around, and also we have boarded quite a few doctors, and it all looks good.
You're expecting 20% growth on the top line this year?
Yeah, late teens to 20%. Yeah.
Okay. Are you already seeing a recovery in terms of your occupancies, for Q1?
Yeah. Generally, the Q1 also goes slower, but we start seeing uptrend.
Okay, you're seeing a bit of an uptrend. And what about the average revenue per occupied bed?
See, the RPOPs were kind of the last quarter was about 8,000, I think. And so what we've been trying to guide actually is an RPOP is very dependent on the ALOS. So we've been talking about ARPP, average revenue per occupied bed, per patient. So that's been steadily growing. So last year's complete year's ARPP is about 108,000, which is about 5.6 growth. So being a medical business, the RPOP is always a kind of varies with the average length of stay. Being a medical hospital is a difficult kind of a RPOP guidance. Maybe ARPP is probably a more accurate guidance. We've been talking.
So what is it? What is it on that? Average revenue per patient?
108,000. We have grown about 5.6% last year. Last couple of years also have been around 6%.
Right. What about your margins? You had said earlier that you would be expecting 25 to 27% pre-Ind AS margins. If you could, reiterate that for us. And at the same time, Rajamundry, you said that was delayed to the first quarter of FY26. Has that been further delayed, or is this on track?
No, it's on track now. So we'll be kind of opening up in the next, 30 days' time, Rajamundry. And also the 2 spokes in Bangalore is going to come by the end of the second quarter. So overall, we'll have about 250 coming into the operations this year.
And margins, 25 to 27%? You hold on to that?
Yes. Like last time we discussed a year ago that, whatever the bed addition coming in, still we maintain about north of 25% of the EBITDA. So probably whenever there's a new beds coming in, probably there may be a margin pressure about 1%. That's what actually we have seen last year, about 0.9% of the margin pressure on the EBITDA.
Okay. I just had a couple of questions. Let's start with the international business, because you get a lot of business from Somalia and other regions, but you've seen a lot of disruption there. In fact, what did you close the year with in terms of the international business? How much did it decline compared to FY24, and what are you guiding for?
We're down almost by kind of 11 crores from last year. And we were actually, the budgets we were almost, we were able to do only 50% of the budget of international business. So it's looking a bit better now, positive. Still there are macros of the Bangladesh, Somalia, and Oman. Some of the challenges are there. So we are working on the new geographies, other countries. Hopefully we do much better this year.
Okay. The other thing which I wanted to touch upon is your IVF clinics. You've got around 12 operating currently, and you've said that you've seen good traction in it previously. So what was the revenue generated from the IVF clinics this quarter, and what are you estimating in it?
There's still a low base, but we've grown about 70% of IVF. I think then a year we clocked about 40 crores of IVF business. So it's a very recent business. The IVF clinics, which we have not done outside the hospitals, they're all within our existing hospitals. So it's a very organic business, which we are trying to focus it based on our reputation and also doctors. And it's like model is a full-time doctors driving the IVF business based on the brand and credibility and reputation.
So, 40 crores is what your annual revenue this year has been. We're just trying to figure out on a low base how much higher can it grow. And alongside IVF, you also have Butterfly Essentials, which is basically mom and child care, which you have also opened in 15 hospitals, right? So what's the revenue of that business this quarter? Together, IVF and, this Butterfly Essentials, what's the scale that you're expecting here?
I think the IVF is clinical business. The Butterfly Essential is more of retail. And I'm not really, I don't remember how much is exactly the Butterfly Essentials clocked, about an average a crore rupees per month. That's what he's been doing it. We just recently kind of going on online as well. So it's setting up well, and they're all in the store. The stores are within the hospitals only. And we are trying to take some new initiatives and also product ranges and those things. So being a hospital, we're trying to be a little cautious about, the people's expectations and brand, and also that kind of deliverables to the patients. So we are optimistic about the Butterfly Essentials growth of it as we move forward, both on online and offline.
Okay. You also have a hefty amount of cash on books. What's the utilization plan?
So we have a large projects coming up in Gurgaon, which is about almost 450 crores of capex is going to go for the Gurgaon. And also that we have still the current year projects, and also the Coimbatore is another one which is in pipeline. So we have some acquisitions working on it. So probably kind of utilize some of the cash for that.
And what about the acquisition that you were eyeing in the western part of the country? And how long before some of your other geographies break even? Just trying to understand the operational performance here.
And I think the acquisitions kind of work. We are working on that. It's probably kind of a bit early to talk about it. So we will come back to you soon on that.
And what about the break even of all your newer properties?
So the last year we opened about 3 new hospitals in Bangalore as well as Hyderabad and Chennai. So Hyderabad is actually it always breaks even the first year itself. Bangalore is close to it, and Chennai is kind of will take another 6-8 months time to break even. So I think by end of the year, the current financial year, we should be able to kind of even it or have a little positive EBITDA.
Okay, all right. We're going to leave it on that note. Thanks very much for joining in and speaking with us. So that is Rainbow Medicare. Stock is up around 0.2%. They are seeing some challenges when it comes to the international business, which has dipped around 11 crores as compared to the previous year. But separately, they are still guiding for around 20% in terms of margins, and an increase in our ARPOBs as well. Or average revenue per patient. We'll take a short break. On the other side, the spotlight is on PSU banks and how they perform in Q4 FY25. That coming up next. Stay tuned.